Hi everyone, welcome back. Today I will be talking about Medicare proposed rule for hospital outpatient and ambulatory surgical center quality reporting programs for the calendar year 2022. I will also talk about the request for information from Medicare for the hospital inpatient quality reporting program. CMS is proposing changes to the Hospital Outpatient Quality Reporting or OQR and Ambulatory Surgical Center Quality Reporting or ASCQR programs to further meaningful measurement and reporting for quality of care in the outpatient setting, closing the health equity gap in CMS quality programs. Consistent with Executive Order 13985 on advancing racial equity and support for underserved communities through the federal government, CMS is committed to addressing significant and persistent inequities in health outcomes in the U.S. through improving data collection to better measure and analyze disparities across programs and policies. In the proposed rule, CMS is seeking input on ideas to revise the hospital outpatient quality reporting and ambulatory surgical center quality reporting programs to make reporting of health disparities based on social risk factors and race and ethnicity more comprehensive and actionable for facilities, providers, and patients. Under the Hospital Outpatient Quality Reporting Program, CMS is seeking comment on future potential additional stratification of quality measure results by race, Medicare, Medicaid dual eligible status, disability status, LGBTQ+, and socioeconomic status. The agency is also seeking input on potential future application of an algorithm to indirectly estimate race and ethnicity to permit stratification of measures, in addition to dual eligibility for facility-level disparity reporting until more accurate forms of self-identified demographic information are available. CMS is also seeking comment on the possible collection of a minimum set of demographic data elements by facilities at the time of admission and using electronic data definitions to permit nationwide interoperable health information exchange for the purposes of incorporating into measure specifications and other data collection efforts relating to quality. Under the Ambulatory Surgical Center Quality Reporting Program, CMS is seeking comment on ways to address the unique challenges of measuring disparities in the ambulatory surgical center setting, such as small sample sizes, ambulatory surgical center specialization, and the relatively smaller proportion of patients with social risk factors. Number 2, the utility of neighborhood-level socioeconomic factors toward measuring disparities in quality of care outcomes for ambulatory surgical centers. And number 3, ways social risk factors influence the access to care, quality of care, and outcomes for ambulatory surgical center patients in general or for specific ambulatory surgical center services. Future of digital quality measurement. CMS is seeking comment on future plans to modernize its quality measurement enterprise, the potential definition of digital quality measures, standardizing data required for quality measures for collection via fast healthcare interoperability resources-based application programming interfaces, leveraging technological opportunities to facilitate digital quality measurement, better supporting data aggregation, developing a common portfolio of measures for potential alignment across CMS regulated programs, federal programs and agencies, and the private sector. Hospital Outpatient Quality Reporting or OQR program. The Hospital Outpatient Quality Reporting Program is a pay-for-reporting quality program for the hospital outpatient department setting. The Hospital Outpatient Quality Reporting Program requires hospitals to meet quality reporting requirements or receive a reduction of 2 percentage points in their annual payment update if these requirements are not met. In the calendar year 2022, OPPS/ASC proposed rule, CMS is proposing to adopt 3 new measures, including the COVID-19 vaccination of healthcare personnel, National Quality Forum Quality Measure 0431. Make the reporting of 2 voluntary or suspended measures mandatory, remove 2 measures, and update the validation policies of the hospital outpatient quality reporting program to reduce provider burden and improve processes. In addition, CMS is soliciting comments on potential future measure adoptions. Ambulatory Surgical Center Quality Reporting or ASCQR program. The ASCQR program is a pay-for-reporting quality program for the ambulatory surgical center setting. The ASCQR program requires ASCs to meet quality reporting requirements or receive a reduction of 2 percentage points in their annual fee schedule update. If these requirements are not met, CMS is proposing to adopt 1 new measure, the COVID-19 vaccination of healthcare personnel, National Quality Forum Quality Measure 0431, and to make the reporting of 6 voluntary or suspended measures mandatory. CMS is requesting comment on quality measures for pain management procedures performed in this setting. Hospital Inpatient Quality Reporting or IQR program and Medicare Promoting Interoperability program. The Hospital IQR program is a pay-for-reporting quality program. By law, hospitals that do not submit quality data or fail to meet all hospital inpatient quality reporting program requirements are subject to a 1/4 reduction in their annual payment update under the Inpatient Prospective Payment System or IPPS. The Medicare Promoting Interoperability Program for eligible hospitals and critical access hospitals began in 2011 as authorized by the American Recovery and Reinvestment Act of 2009 or ARRA and provided incentive payments for the demonstration of meaningful use of Certified Electronic Health Record Technology or CEHRT through 2016. Currently, hospitals are required to report 3 self-selected electronic clinical quality measures or ECQMS and the safe use of opioids ECQM for the calendar year 2022 reporting period and subsequent years for the hospital inpatient quality reporting program and the Medicare Promoting Interoperability program. As CMS considers future reporting on the safe use of opioids ECQM, CMS seeks comments on the appropriateness of maintaining this previously finalized policy or instead proposing in future rulemaking to allow hospitals to self-select the safe use of opioids ECQM from their finalized set of ECQMS. CMS also seeks any other information or considerations commenters may have to inform future measure updates to the safe use of opioids ECQM. Here you will find reference to the material that was used to create the content of this video. If you found this information useful, please consider subscribing to my channel. Thank you for stopping by. Hope to see you soon. Bye now.